Hi, this is Dr. Nidhi Kumar Patel, neurosurgeon from Rajkot. Today we will see endoscopic interlaminar dorsal decompression under epidural analgesia. Patient is a 55-year-old lady who came to us with spastic paraparesis with the posterior column signs for 3 months. She had weakness on left side more than right. Her MRI showed a D10-11 level myelomalacic exchanges due to disc plus ligament flavum thickening. Her sagittal and axial MRI images are being shown here, which shows this compression from both the sides. So plan was to do full endoscopic D10-11 interlaminar decompression under epidural analgesia. We are doing the approach from the left side, so 3 o'clock being the caudal, that is towards the D11 superior lamina, 9 o'clock being cranial, D10 inferior lamina, 6 o'clock will be our lateral side, that is towards the facet, and 12 o'clock will be the towards the midline or spinous process. So after clearing the soft tissue, we have to find the landmarks, that is D10 IAP will be my first starting point. Here this patient had some advantage. We had little advantage because the patient had one level below was some mild wedging, so that helped us in confirming the level intraoperatively easily. Otherwise in thoracic level it is little tricky, and it's a time consuming, and we must not go wrong in that. Here that interlaminar space is almost interlaminar window starts almost below the level of almost at the half level of the pedicle. So that also sometimes confuses a lot, especially for the beginner. So once we start drilling, we start from the IAP, then we go cranially towards the inferior part of the lamina of the superior vertebra, that is D10's lamina. So as we continue, then we get some space, and our orientation becomes little better as ligament flavum starts appearing. In dorsal spine, anatomy is much different than what we usually find in lumbar. In dorsal, usually facets overlie each other, so that's what we will also show here in this video. This is laterally, that is towards the D10 IAP, and once we get the half facet drilling, we start seeing the SAP, and that's when our orientation becomes easier and we can proceed faster. I prefer diamond drill because it's advantageous, because soft tissue doesn't get stuck like how it gets with cutting bar, and bleeding is much less, so I can drill faster because in decompression cases, usually in endoscope, its majority of work is usually done by the drill. Better the drill, it's the faster the work and less the struggle. So I am continuing the drilling, and as I proceed, as I finish this IAP and lamina, I go towards the midline. This is the part of base of spinous process drilling, and once I can drill there, I will be able to extend my interlaminar window towards the opposite side as well. Once I have done enough drilling superior of the superior lamina, I will turn towards the inferior drilling, that is SAP of D11 and superior part of lamina on the same side as well as opposite side. I prefer not to touch ligament even though it starts coming. I just keep the ligament till the last part, till my bony work is complete, so I don't have to worry about inadvertent dural injury, and that way my work also is little faster. So this is towards the opposite side, that is on the right side, and once we towards the right side and towards the inferior side. Now we have almost completed IAP drilling, and now we are proceeding towards the SAP drilling on the ipsilateral side, that is on the left side. The white structures where what you are seeing, that is SAP. Now I am using curate to detach the ligament flavum attachment from the inferior lamina and the SAP. This is the inferior laminal detachment, and this is SAP, which I had drilled more, but for the sake of shortening, I had just cut it down. So afterwards I had removed the ligament in one piece, and this is the spinal cord, nicely decompressed, and it is pulsatile very well. On the opposite side, towards that right side, you can even see that part of the root coming out of the thecal sac. And since it was whole surgery was done through a 1 centimeter single cut. Thank you.